Type 2 diabetes is on the rise. At last checking, there were almost 4 million people with an active diagnosis of type 2 diabetes. I think there's a very valid role for supplementation, particularly in this at-risk population, because so many patients that end up with the diagnosis of type 2 diabetes have poor diets, because it requires a huge shift in behaviour. Metformin classically will cause tummy upset. So I'll often see patients that come in feeling bloated with diarrhea, and often to the point that they struggle to take the medication, which then will directly impact on their ability to absorb nutrients.
So there's a few other specific nutrients that may be disrupted, like vitamin B12, B6, folate, especially when it comes to metformin in particular, because of that disruption in the absorption of certain B vitamins. And I know B12 is quite integral to energy, brain health, so many different functions in the body.
It's really, really important that we as doctors are quite proactive in trying to empower patients to have the knowledge to look out for these symptoms of deficiency. We can do blood tests that look at their vitamin B12 levels, at their folate levels, at their iron levels, but we don't have the facility to examine their body from a blood point of view for micronutrients, and that's where my huge concern would be. So we can replete some of those deficiencies, but actually it's much more important that actually at the very beginning of commencing a medication, that patients know about these relative risks so that they can have a heightened radar to be aware of that, to be tuned into their gut and the gut kind of side effects of all kind of diabetic medication, and to be proactive, not reactive. Consider supplementation with an accredited, well-regarded supplement that your doctor may not have huge knowledge around, but you can be signposted to a decent health food store where they can actually advise you as well.